The CAP classification. It's a classic exam question, right? But it's way more than just a list you have to memorize. It actually tells a story. The story of what happens to a leg when its veins start to fail. So in this explainer, we're going to walk through that story, step by step.
So how do you even tell the story of a failing vein? I mean, think about it. When the veins in your legs start to go, they don't just, clock out overnight. No, they tell a story, a slow, progressive one about pressure building up and things starting to break down. And the CAEP classification? Well, that's the language we use to read and tell that very story.
And the best way to really get this story in your head is to picture a staircase. We're going to call it the venous staircase. Each step up represents the disease getting a little worse. And for our little journey today, the CEAP classification is going to be our map, our guide, helping us understand every single step from the very bottom to the top.
Okay, so let's start climbing. We're going to focus mostly on the C in CAP. That C stands for clinical signs. And honestly, this is the most visible, the most intuitive part of the whole thing. It really is the core of our venous staircase.
All right, we're starting at the bottom. Ground zero, C0. Here, the struggle is totally invisible. The patient feels it, for sure. They'll tell you their legs feel heavy, achy, just plain tired, especially at the end of the day. But when you take a look, the skin is perfect. Not a single sign. It's all about the symptoms, with zero visible evidence.
Okay, now we're taking our first steps up that staircase. This is where the problem starts to, well, come into view. The invisible struggle is about to become visible.
So at step C1, you start to see these really delicate signs. Little, tiny, thread-like veins. They look almost like a spider's web just under the skin. We call these telangiectasias, or reticular veins. And the key thing to remember here is their size. They are super small, less than 3 millimeters across.
Now we're climbing up to C2, and things are getting a lot more obvious. Those little threads? They've turned into what look like winding rivers. These are the classic varicose veins. They're dilated, twisted, kind of bulging, and now they're bigger than 3 millimeters. This is that hallmark sign that most people think of when they hear venous disease.
And this picture right here gives you a perfect look at C2. You can really see how dilated and tortuous these varicose veins are. This is that classic can't miss it sign of some serious venous hypertension.
As we keep climbing, the consequences of all that high pressure start to get more serious. The story isn't just about visible veins anymore. Now we're talking about actual damage to the tissues around them.
At C3, the pressure inside those veins gets so high that fluid actually starts to leak out into the tissue. It's just like a rising tide. And this causes edema, or swelling. You'll usually see it at the ankle, and it almost always gets worse as the day goes on.
Okay, C4 is a really big deal. This is the step where the skin itself starts to suffer permanent damage. And it's actually broken into two parts. First, you have C4A. This is where you'll see that brownish staining from iron deposits, or maybe some red, itchy eczema. But then you get to C4B, and the damage is way more severe. The skin gets hard, almost woody. We call that lipodermatosclerosis, and you might even see these white, star-shaped scars called atrophy blanche.
And that really severe scarring, that lipodermatosclerosis sclerosis we just talked about, it can actually constrict the leg so much that it takes on this very unique shape, an inverted champagne bottle. It's a super memorable clinical sign for advanced C4B. You see that? You know exactly where you are on the staircase.
We've now arrived at the very top of the staircase. The pressure, the skin damage, it's all become so severe that the body's ultimate defense, the skin itself, has been breached.
Now the crucial point here, and this is a common exam trap, is telling C5 and C6 apart. C5 means a battle was fought and won. You see the scar from a venous ulcer that has healed. C6, on the other hand, is the active conflict. You're looking at an open wound, an active ulcer, and it's most often found in what we call the gaiter area, right above the inner ankle bone.
And wow, this image really drives it home. This is a C6 active venous ulcer. You can see that open wound, the damaged skin all around it. This is the culmination of that whole story of chronic venous hypertension. It's the final step on our clinical staircase.
So there you have it. You've climbed the whole staircase. You get the story of the leg. Now let's make sure we lock in this knowledge so you are absolutely ready for your exams.
All right, to remember these stages for life, you just need this simple recap. Think of the 3 E's and the 3 U's. It's so easy. C1 is for ectasia, think spider veins. C2 is for enlarged veins, varicose veins. C3 is for edema.
Then C4 is for ugly skin changes, C5 is for a healed ulcer, and C6 is for an active ulcer. See? Simple.
And finally, let's not forget the rest of the acronym, right? E is for etiology, the cause. Is it primary or secondary? A is for anatomy. Are we talking superficial, deep, or perforator veins? And P is for pathophysiology. Is the problem reflux or an obstruction? You put all of that together, and you have the complete, detailed CEAP code for any patient. So that's it. You've walked the entire path, all the way from that first little spiderweb to the active ulcer. You don't just know a list anymore. You actually understand the story. The venous staircase should be crystal clear in your mind now.